Hello, I hope you're well. This is Mana the Physio. I am a physio at the Humble Rehab Physio Group, and today I would like to talk to you about musculoskeletal injury. What is a musculoskeletal injury? So basically, we'll be doing a series of videos that will be focusing on musculoskeletal injuries, what they are, how they affect your body, how they affect your work, how they affect your finances, and how they affect your family. So what is a musculoskeletal injury? A musculoskeletal injury is basically an injury that you incur on your muscles, your ligaments, your joints, your cartilage, excuse me, your cartilage, your bones, the structures around your joint. So it basically affects all these structures, and it makes it very difficult for you to be able to perform functions because of the pain incurred there, as well as the damage of the structures. The injury usually occurs as a result of repetitive action, repetitive movement, rather than a single movement. So like I said earlier, these type of injuries will affect your finances, because they are expensive to treat, whether you need to use a medication that is going to increase the that is going to decrease the inflammation over that period of time. You are spending something on your finances. Most of the time it will require you to go to a physio or a doctor, um, and also a very huge portion of these type of people that suffer from these injuries will need to incur surgery, which is very expensive and costly. And this affects your productivity, it affects your lifespan in the workplace, it affects your ability to create wealth for yourself and your family, and your ability to be able to support your family in order to live a dignified life. So the aim of this video is to help you prevent all these things in order to save money on your pocket, to continue being able to be there for your loved ones and support them physically and financially, and also to be able to have a longevity of your ability to work, you know. Yes, so basically that is the benefit of this video, the benefit of this education that I'm sharing with you today. So we usually go and do what do you call presentations in different workplaces in order to help people to be aware of these injuries and to prevent them as much as possible. You do not know the amount of people that I see at our practice that come to us complaining specifically about these musculoskeletal injuries, especially neck and back pain, which is one of the most common forms of these musculoskeletal injuries. They are the most prevalent kind that I am seeing and that my colleagues are seeing within the scope of physiotherapy. And you find that some people are able to respond to physio, which is a very large group. They are able to respond to physio depending on the severity of the condition, but some will not be able to respond to physio. They will end up going for surgery, and within that group too, you will find that there will be people who have undergone surgery but it did not become successful. Not trying to scare you, but I'm trying to let you in and to let you see the road that is ahead of the injury that you're currently struggling from. So let's talk about it. These musculoskeletal injuries. There are specific things in the workplace. You will hear me talking about the workplace mostly in this video because we often term these musculoskeletal injuries work-related musculoskeletal injuries because that is where we spend most of our time. Our Mondays to Fridays and majority of our hours during the day are spent in the workplace, performing certain activities, of which majority of those activities are repetitive activities which we perform on a daily basis. So depending on the type of job that you're doing, whether you're working on a call center, picking up the phone every day, a sedentary activity where you're working on a computer, a moderate type of activity that requires you to walk and stand, an activity that requires you to stand most of your day, an activity that requires you to lift loads, lift patients, your injury will be specific to the type of job that you do. So for a call center agent, you will notice that they will complain of a pain that is associated with that type of a movement, or that type of a movement. With a person who's lifting, they will complain of a pain on the back, as a strain that happened as a result of a lift that they were not aware of. So which leads us to an important aspect about these musculoskeletal injuries, which are the risk factors. So the risk factors include unawareness, not being aware of your posture. That is a very important aspect. Number 2, repetition of activities unconsciously. So you're repeating this activity in the workplace. So when we're talking about this repetition within the workplace, we're not talking about it in order to blame the employer or your work environment, but we're talking about it in order for you to be aware, so that you can be able to identify these movements that are causing the pain or making the injury worse, so that you can reduce them, change them, and respond better, and have a pain-free life, or less pain, as you are doing your activities. So we've talked about repetition as one of the risk factors to these injuries. Another risk factor is force. So the push and pull factor, which is why we usually encourage people to push rather than pull, because when you pull, you're causing more strain to your body, which could possibly lead to injury. But if you push, but also with that pushing, you need to push rather using your body instead of using your limbs, because the closer a load is to your body, the less the risk of injury. So basically, those are the risk factors that one needs to look at within the work environment. You need to be aware of your posture, you need to be aware of those repetitive patterns, and rather than continuing and pushing through the pain, try and find an alternative position that is less painful, because if you're pushing through that pain and it's sore, it means that there's something wrong that is happening in that joint. So you need to find an alternative position that will help you. So those are the risk factors, and basically the preventative principles that can help you with that is, like we said previously, being more aware of your posture, identifying those repetitive patterns that are painful, and trying to find alternative positions that will be less painful and will cause less harm to your body. So whatever harm that is happening to your body, whatever pain that is happening to your body is real. It's not that it's not there. It is real, and the more you neglect it or the more you ignore it, is the more it affects the longevity of your place in that workplace, and the longevity of your productivity, the longevity of your ability to produce well, to play with your children, to play with your family, to support your family, to improve your dignity. So it's very important to be aware of these things. These principles sound like very simple principles, which would not help in any way, but believe me, I've seen numbers and numbers of people being helped by the information that I'm sharing with you today, and numbers and numbers of people saving a lot of money, because believe me when I say this, surgery is very expensive. Surgery can be very, very expensive, whether you've got a medical aid or what. Sometimes, they will give you the cost of that surgery and say that your medical aid will cover it, but you will get the surprise of your life after you've performed that surgery and found out that you are still owing 100,000 to the hospital, which you do not have, which you've never planned for, in your financial projections. So one needs to be very, very careful. Let's make a typical example. Let's just make a simple example of a person working in front of a computer. This person works in front of a computer. I'm just gonna make an example of a person who's breaking all the principles of injury prevention. So this person has got the computer in front of them, and they have placed their computer on a desk that has got no space for their legs to go in. So basically they're sitting on a computer facing this way, with their legs facing this way, their body facing this way, and they spend their whole day working on the computer like this. This is causing a strain on your neck and on your back, as well as your arms. So that is one of the no-nos, So the correct position would be to have yourself in front of the computer. Let's start with the head, from head down to the legs. Your head should be facing the screen in a neutral position, not tilted up or down or sideways, but rather in a neutral position, with your neck in the neutral position, your shoulders relaxed, your elbows either supported or unsupported on a desk in front of you. The keyboard is in front of you, your elbows are at 90 degrees, and you're working on the computer. Your hips are at 90 degrees, your knees at 90 degrees, and your feet are flatly placed on the floor, you see. And then let's say, for example, you are working on a pile of papers that is next to you, or you're typing a document and typing it onto the computer. So rather than doing that, just a simple movement of doing this and that is a simple movement. Like we say, if you're going to be doing it 1 or 2 or 3 times a day, but if you're going to be doing that 100 times a day, this is going to be increased mileage on your neck. It's like driving a car at 260 kilometers per hour on a gravel road. That will do something to your tires, and that will cause some damage to your car, and you are unnecessarily using a mileage unnecessarily, like I say, you are using this mileage unnecessarily. So the correct thing to do with this type of situation is to take that piece of paper you're typing from and place it or stick it next to the computer, and rather using small movements for taking the information from the piece of paper to the computer, rather than big movements which can cause a strain on the joints of your neck, causing arthritis, causing nerve impingements, causing muscle strain, instability of the muscles, and a whole domino effect of injury, that is caused by one thing leading to another. And then so basically that is the type of example that I can give you when it comes to working in front of a computer. There are many other examples when it comes to lifting loads, which we'll share in videos in the future. But if you're interested in this type of training for you and your organization, please do contact us on the contact details provided on the description box. Contact us and we can arrange an in-house training for you, where your staff will be trained on these principles. And I tell you, this is the best gift that you could give to anyone, because this type of advice that I'm giving you today is, like I say, worth millions and millions. It saves on your pocket. So it won't only be saving on your pocket as an employer, it will be saving a family. It will be saving the working ability of a family, the ability to put food on the table, the ability of the people that you are working for to be able to support the education of their children, to play with their children, to engage with their families and to live morbidity free life, decreasing the rate of disability and decreasing cost to their pocket and preventing so much injury. So please do contact us on the contact details provided below. Thank you and bye-bye.